Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 95 of the Ask Dr. Angela podcast. Hoping that today's episode finds everyone alive, well, and being productive, yet happy. So much has been going on since we last convened. We are really on the home stretch of getting this Ask Dr. Angela, What to Expect During Pregnancy and Beyond book. We are diligently working on completing the cover of the book and, setting up all kinds of focus groups so that we can get your input. It has been a labor of love. To say that I've been a little bit stressed would probably be a bit of an understatement because I've been doing this in addition to my regular duties as an OBGYN. So it's been a lot, but I'm so excited to get this to you because it's going to be amazing. And I really think that you'll truly appreciate it. Today's topic is going to be about vaginal discharge, and I feel like I see at least 10 visits a day, and that's a lot, but 10 visits a day about vaginal discharge. I feel like I should do like a got discharge commercial. Instead of got milk, it should be got discharge, because so many women and girls and young ladies have no idea that their moms, their grandmothers, their girlfriends also have vaginal discharge. And oftentimes when I'm in these visits with my patients, I'm like, do you not realize that you're not the only one that wears panty liners, that your girlfriends, that your moms, your grandparents, everyone's wearing panty liners because everyone has discharge. We talk about almost everything else. How does this not come up? And I completely get it. Discharge can be really annoying. It's like your vagina has a cold sometimes, you're just walking along and plop, discharge, and it's slimy and it's wet and it's just really annoying. I completely get it. And then it stains your panties and, I could just go on and on and on. I completely understand. So this is what you need to know about vaginal discharge. Even though it is completely annoying at best, we all get it. And the amount that we get and the type that we get really kind of depends on where we are in life. Young girls, pregnancy, are we ovulating or are we postmenopausal? So the stage of life that you're in will determine the type and characteristic of the discharge that you are having. What you need to realize is that all women get vaginal discharge. And my general rule of thumb is as long as it doesn't itch, burn, smell bad, or cause you pain, other than being annoying, it's entirely normal. And so what is normal? What do we need vaginal discharge for? My menopausal patients are probably thinking, oh my gosh, we wish we had more of that discharge that we used to have back in the day because our vaginas now are entirely dry. But anyway, discharge or vaginal discharge serves like a housekeeping duty. It helps to keep the vagina lubricated. It helps to maintain the bacterial balance in the vagina, and it also helps to get rid of dead cells in the vagina. And so vaginal discharge, in a nutshell, keeps the vagina clean, and it also helps to prevent infection. You might notice a change in your vaginal discharge depending on, again, where you are in your menstrual cycle. It might be thicker at some point and then thin. If you're ovulating, breastfeeding, or if you're sexually aroused, you might notice that it's more copious in amount. And the one thing about the pregnancy state is that I always tell my patients the amount of discharge that you get increases the further along in gestation that you are. Now, remember what I said. As long as your discharge doesn't itch, burn, smell bad, or cause you pain, it's probably normal or physiologic. But if your discharge is turning like a funky color, green, blood tinged, or if it smells bad, it certainly could be a sign of an infection or something not so good going on. And those are absolutely grounds for you to reach out to your OBGYN for further investigation, which usually will include some sort of workup for vaginal cultures, looking for vaginal infection, etc. Other quick pointer is, ladies, don't douche. That is so 80s. I always tell my young folks and my folks in general, patients in general, douching went out in the 80s. So don't douche, because that totally offsets the normal flora or bacteria that's supposed to be in the vagina, and then that can actually predispose you to getting certain types of infections. So hopefully this quick podcast on vaginal discharge, what it is, why we have it, and what to expect, has been helpful to someone, specifically since I see a lot of folks for vaginal discharge on a day-to-day basis. Thank you so much for tuning into today's episode of Ask Dr. Angela. If you have a question or a topic that you would like featured on the podcast, you can direct message me on Facebook, Ask Dr. Angela. That's ASK space DR space Angela, ANGELA. You can hit me up or direct message me on Twitter at Dr. Angela OBGYN, or you can go to my webpage, www.askdrangela.com. That's ASKDRANGELA.com. Click on the microphone on the right-hand side of the page, leave your question, and hopefully we'll get to it and use it. Not hopefully, we will eventually, but we are getting just slammed with so many questions via all different avenues, whether it's email, submission through the webpage, or direct messages on social media. Would love, love, love to hear from you. If we happen to use your question on our podcast, someone from my team will reach out to you and we will send you one of our bomb-ass t-shirts. Very excited about these t-shirts. They're all over social media if you're curious as to what they look like. But we would love, love, love to send you one of these. In closing, I would like to leave you with this. Face your fears. Enjoy success. Remember, when you dare to face the things that scare you, you open the door to freedom. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 96 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.